1. The nurse is caring for a patient with chronic obstructive pulmonary disease, COPD. Which of the following oxygen delivery systems is most appropriate for this patient? A. Nasal cannula. B. Simple face mask. C. Non-rebreather mask. D. Venturi mask. Answer: D. Rational. The Venturi mask is best for COPD patients as it delivers a precise oxygen concentration, minimizing the risk of CO2 retention. 2. A patient with asthma is prescribed a short-acting beta agonist, SABA, inhaler. What is the primary action of this medication? A. Reduce airway inflammation. B. Relax bronchial smooth muscle. C. Decrease mucus production. D. Suppress the immune response. Answer: SABAs like albuterol work by relaxing the bronchial smooth muscle, providing quick relief from acute bronchospasm. 3. The nurse is teaching a patient about the use of an incentive spirometer. What is the primary purpose of this device? A. To measure lung capacity. B. To strengthen respiratory muscles. C. To D. Prevent atelectasis. To deliver medications. Answer: Rational. Incentive. Spirometers help prevent atelectasis by encouraging deep breathing and lung expansion. 4. Which of the following ABG values would indicate respiratory acidosis? APH 7.48, PACO 232, HGBPH 7.32, PACO 248, HGCPH 7.38, PACO 240 HGD, pH 7.50, PACO 228 HG. Answer: Rational. Respiratory acidosis is characterized by a low pH and elevated PaCO2 due to impaired ventilation. 5. The nurse is assessing a patient with pneumonia. Which of the following findings is most concerning? A. Crackles in the lungs. B. Fever and chills. C. Dark greenish sputum. D. Respiratory rate of 32 breaths / min. Answer: Rational. A respiratory rate of 32 breaths / min indicates severe respiratory distress and requires immediate intervention. 6. Which patient is at highest risk for developing a pulmonary embolism? A. A patient with a history of deep vein thrombosis. B. A patient with asthma. C. A patient with pneumonia. D. A patient with COPD. Answer: Rational. Patients with a history of DVT are at higher risk for PE due to the potential for clots to travel to the lungs. 7. The nurse is caring for a patient with tuberculosis. Which type of isolation precautions is required? A. Contact precautions. B. Droplet precautions. C. Airborne precautions. D. Protective isolation. Answer: C. Rational. ITB requires airborne precautions due to the small size of the respiratory droplets that can remain suspended in the air. 8. A patient is receiving continuous oxygen therapy at 4 L-min via nasal cannula. Which of the following interventions is most appropriate? A. Decrease fluid intake. B. Encourage smoking. C. Cessation monitor for signs of oxygen toxicity. D. Apply petroleum jelly to nostrils. Answer: Rational. Monitoring for signs of oxygen. Toxicity is essential as prolonged high oxygen levels can lead to toxicity.